So, sir, you said actually there is a decline. So, as the age increases, so there is a decline in equality. So, what might be the reason, sir, for the drastic decline in the equality in these days?
In these days, because of the food habitat what we have, and because of the sedentary work life, and because of the pollution, because I mean everything matters. So if you see in terms of male only, in 1985 or 1950s, you have a normal count and normal, I'm not sure about the which guideline, 1985 if I'm not wrong. So as per WHO 1985, they had somewhere around 100 to 200 counts per million. Now it has drastically declined to 15 millions.
Oh my God, that's a
Yeah,
too drastic decline.
60% normal forms, normal sperms, it has declined to 4% now. Motility, it was somewhere around 60%. Now it has declined to 32%. The progressive motility. You can see a clear decline in the semen parameters. Same goes for women's also. There will be PCODs, there will be early menopauses. There are many things that contributes the factor for decline in the egg quality.
So, are there any precautions they need to take to
A healthy
increase?
lifestyle, exercise, and stress-free life. That is also a factor.
So, sir, what is cryopreservation, sir? So many people are talking about that. As embryologist, what is that, sir?
Cryopreservation is nothing but freezing of your gametes. Freezing of your gametes, as in like you are arresting the whole biological process.
Social embryo freezing and cryopreservation are same, sir?
Same.
Okay.
Cryopreservation is nothing but preserving your gametes at the cryo state. Cryopreservation. So it is like arresting the biological event for that moment. You can even resume it after thawing. That is what we call thawing of embryos. So cryopreservation is something you are freezing the egg from normal 37 degree to minus 196 degrees, where we store the eggs or the embryos or the sperm to arrest the biological event for us to resume further. So minus 186 is attained by liquid nitrogen. So we have something called liquid nitrogen which generally stays at minus 186. That is how freeze.
So, sir, in some patients there might be some genetical abnormalities or some systemic diseases which can transfer to the baby.
Yes.
So, through IVF, can we reduce the transferring of those genetic problems to the baby?
Yes, we do have something called thalassemia, sickle cell anemia. So these are the monogenic diseases. So what actually we do is like we take the biopsy of the embryo. That is what we call PGS biopsy, embryo biopsy. So there is a 3 levels of diagnosis PGD, that is aneuploidy testing. Another one is SR, structural rearrangement testing, and another one is called monogenic diseases, PGT-A, PGT-SR, PGT-M. These are the 3 testing we do. For aneuploidy, if there is any aneuploidy like addition of any extra chromosome or anything, that will be avoided. And euploid embryo, that is having a good DNA content, will only be transferred. And there is something called structural rearrangement, where the inversion or translocation or anything, deletion or anything, will be carried out by structural rearrangement or monogenic PGT-M.